This is Merle Whitley, 53-year-old male. Came in for right upper back pain on the middle, reports it goes all the way down into his buttocks, urinary frequency and burning, vomiting for 2 days. He states the pain started 4 days ago in his right upper back and it's been constantly there. Feels like it's burning. He's had no relief at home. The pain is worse with urination and then radiates into his buttocks. It states he's tried ibuprofen at home with no release. Only significant medical history is BPH, high blood pressure, and high cholesterol. He takes atorvastatin 40 milligrams PO daily, lisinopril 20 milligrams PO daily, and tamsulosin 0.4 milligrams daily. No known drug allergies or medication intolerances, no significant chronic illnesses other than the previously mentioned, no major traumas. Only hospitalizations were for appendectomy and cholecystectomy that were greater than 10 years ago. No notable family history. Social history includes weekly alcohol consumption, but patient does not report that as a problem. Denies any blood in urine, just reports darker color, positive for suprapubic pain and tenderness, no abdominal pain other than above the pubis. Assessment-wise, the patient's temp is 101.3 Fahrenheit, tachycardic at 115, blood pressure 125/80, respir's 18. Looks ill upon assessment, just kind of that pale diaphoretic look. Respir's easy, non-labored. Cardiovascular assessment intact, no abnormalities there. Gastrointestinal, abdomen was round, active bowel sounds, soft, non-tender. Bladder was not distended, no palpable masses, positive right CVA tenderness, and no urethral discharge or hernia, and the patient denied any concern for STDs as he's been monogamous with his male partner. So we were thinking acute kidney injury, renal stone, or acute pyelonephritis with the patient's potential symptoms. So we checked GC, chlamydia, and trick just for due diligence. Those swabs are pending. CBC, we found a white count of 18, which is elevated. All other counts in the CBC were normal. BMP was within normal limits, so we can rule out acute kidney injury there. Urinalysis was positive for nitrites and leukocytes. No ketones, glucose, protein, or red blood cells pregnant, and the color was dark. So with the urinalysis having no red blood cells or proteins, we can also rule out renal stones. Also, we can rule out renal stones because patients do have that flank pain, but they don't have worsening flank pain with that tenderness. So we're diagnosing the patient with acute pyelonephritis, which is infection of the upper urinary tract, so between the kidney and the bladder in that area. And with the culture positive for E. coli, we're going to start the patient on Keflex 500 milligrams BID, Zofran ODT 4 milligrams 3 times a day as needed for the nausea and vomiting, and then over-the-counter phenazopyridine for the UTI pain. And we're going to educate the patient on completing the full 7-day course of antibiotic to prevent recurrent infection, color change with that over-the-counter pain medicine for urination, and staining of the potential underwear, Tylenol or ibuprofen for fever and pain management. Follow up with PCP and repeat BMP and UA in 1 week. Increase fluids and increase sexual activity precautions, including washing after intercourse, condom use, and voiding after intercourse.